talk about self-care helping to alleviate the pressure on health systems. Self-care is not new. For millennia, people have been taking measures to prevent disease, promote health, and cope with illness and disability, with or without the support of a healthcare provider. But now is the time to invest more in self-care for two reasons. First, self-care has the potential to alleviate the enormous strain that the health system is under today. Equipping people to meet their health needs through self-care is a key part of any successful strategy to weather the COVID-19 pandemic by reducing the strain on health systems. Expanding self-care offers the chance to go beyond reacting to transform the status quo towards a more sustainable and effective health system for all. Second, while self-care has existed for ages, a growing understanding of the importance of self-care offers the opportunity for even more people to live a healthy life. There has been a proliferation of new technologies, approaches, and health literacy. This is transforming the way people interact with the health system and shows the untapped potential for people to take charge of their own health in ways never before possible. As a result, the World Health Organization published the Consolidated Guideline on Self-Care, and countries increasingly recognize that self-care can be a powerful tool in achieving universal health coverage. We talk with Professor Rosemary Calder from the Mitchell Institute, who are responsible for a number of in-depth research papers and reviews into the state of self-care in Australia. Today we explain self-care.
I've been involved in health policy now for too long to count, but back into the 80s. And I'm a sociologist by background, so my approach to health and my work in the health administration and policy with government agencies in both Victoria and the Commonwealth has been it's been focused about the system more than about the delivery of services to individuals. So my work tends to focus on what do we need to do to improve the way our services work, our systems, and there are multiple systems in health, how they work. How do we address the gaps and lacks that we know exist, even though we have excellent health services in Australia, and we do have very good health outcomes, largely, but we have gaps for individuals, we have gaps particularly for people with socioeconomic disadvantage in their backgrounds, and we have a system that is still based on a 19th century model, which was hospitals were the predominant service that was available, and doctors were the primary providers of health care. It was illness care as opposed to wellness care. We really only understood health to be also about positive health, about maintaining or protecting health for perhaps the last half century or so. I've been with the Mitchell Institute at Victoria University now for some years, and it was a think tank established by that university with philanthropic support that took the focus that health and education outcomes in Australia needed to be lifted, particularly for people who experience socioeconomic disadvantage. And I joined at the start and took on the role of health lead. And the focus that we were asked to take was on preventable chronic disease. And in the chronic disease space in this country, there is a vast array of very, very strong advocacy organisations that focus on hearts or lungs or diseases or whatever. There's been a great deal of very good research. We lead the way in many of the treatments for chronic disease. So I set about trying to find out where we would fit in a very crowded landscape. That's the background to what then developed as the Australian Health Policy Collaboration, which is a network of 70 to 80 experts and organisations who work with us in their own time for us to translate what is excellent evidence across the board into policy that can be used effectively by policymakers, decision makers and service providers. Because as a bureaucrat in my own history and as a person who's worked in the advocacy field as well, I'm painfully aware that good evidence doesn't translate to good policy often enough, and it doesn't translate because it's almost like two languages that can't meet. And so we've positioned ourselves to be the translation from evidence and research to practice and policy. And to do that, we work with a very broad network of experts. So we don't set out to be the content experts, although we do have that capacity. And I've got quite a lot of content expertise in my own right. But we work with content experts to translate what's been shown in evidence to work, to improve preventable chronic disease, to improve the risk factors for poor health. And we translate that into fairly simple propositions, particularly to governments, of course, saying you can do this and you can do it simply and you can do it cost effectively, etc. So that led to us being approached by people in the industry who are very concerned that self-care, the role of people in supporting their own health, was an underdone policy issue, that it wasn't well reflected in either practice or policy or service arrangements. And they asked us, would we be able to do the same thing for the self-care concept? And what we did was, with their support, their financial support, we undertook an audit of the state of self-care in Australia, which is the report you refer to. An element of personal responsibility, but I find that's a difficult term because not everybody understands or knows or is exposed to the opportunity to understand it. I think it's much more an issue of capability, and we need to focus on an individual's capability to engage in self-care, and that's across the health spectrum. So we're going to be encouraging the use of the term self-care as very much an umbrella term for a whole range of other terms that are in use, sometimes connected, often not connected. So self-management is commonly used, particularly in the Australian context, to mean how you help manage your diabetes, your cardiovascular condition, your something. It's a term that does imply you are engaged in management of an issue. Whereas self-care can embrace understanding how, as a young mother, you can improve your child's long-term health by understanding what creates good health in early years and what are the building blocks of good health in the longer term. And we know that socioeconomic disadvantage takes away those resources and capacity from many people. We know the risk factors for preventable chronic disease, the risk factors for preventable infectious disease are much higher in communities of disadvantage, whether they're geographically disadvantaged, as in rural, or whether they're very low income industrial suburbs, or whether they're indigenous communities. It may be the many years that I can attach to my name and age that lead me to say this, but I think the commercial world is often the initiator of change that then becomes important to the role of governments and the role of social policy. I don't think it's been hijacked. I think it's been recognised and is put into use because it is recognised that care of self is actually protective and preventive and therefore vital, really, if we want to maintain what most of us are blessed with, which is a start to life in good health. We have 7 working groups just getting underway that will be looking at the key policy options that would address the gaps in what we identify as the gaps in self-care policy and practice. We don't have, other than self-management for chronic disease, much in the way of a systematic approach to engaging consumers, for want of a better term, in their own healthcare. COVID-19 and the leadership of the National Cabinet has been very strong on your role in protecting your health and that of the nation. That's the best we've ever seen in the way of an understanding of self-care without using the term, and I don't think it has been used that much. We haven't had that approach really articulated in that way before, but we now hear it. So when you look at the potential for self-care, it's about protecting good health and resourcing that protection. We've had prime ministers telling us how to behave. We also need now to think about what are the platforms across the health system that can help people understand what good health is and how to maintain it and how to react quickly when it's at risk. So we need GPs who are much more engaged in self-care, perhaps information, perhaps assessment, perhaps education. We need to think about how do we help people to retain the memory of what self-care is from this period of time into the future. How do we equip children to understand what protective behaviours are and what they can do for their own health and well-being? How do we translate it into the mental health space where capability can be compromised by a mental health condition? But there still should be as much support as we can provide to individuals with mental health conditions to also self-care to the extent that they are able. So there's a whole spectrum. We know that self-management is understood around chronic disease to a large extent, but to what degree do we see health professionals in busy hospitals understanding that they can actually talk with the person for whom they've been the surgeon or the geriatrician or the paediatrician or whatever, and work with them rather than talk to them, hand out paper and let them go. You see a doctor maybe a dozen times a year if you've got a health condition. You have to look after yourself for the rest of the time. How do we resource that in a better way than we're doing now? We do have good evidence of how to target resources or strategies or services or interventions to particularly at-risk groups. We've done it quite well in many cases over the years. We now need to start to think about how do we do that in self-care, and that will be an argument that we will be making through this work. I don't have a view at this stage of what is likely to be the best policy options to improve access for people in disadvantaged environments, because that's the work we're undertaking at the moment. There's a fair amount of evidence available internationally about what works in other people's health systems, so we'll be looking at that obviously. But one of the very best ways that we will improve self-care is education and information for health professionals as well as for individuals. Because self-care is actually, for much of the continuum, a partnership. For early life, family formation, young adolescents, it's quite often your own need for education and information. So we'll need to look at both of those. That may well be the, hopefully, enduring legacy that school environments, because they've been so much in the eye of the storm, will be supported to be much more focused on teaching those life skills from the first day at school, because we might be living with this viral load for a long time, in which case we're going to be managing the risk of infection for a long time too. So hopefully those will be the good outcomes of this, that we will see much more awareness in early childhood and in schools about the importance of information and education for children. It's logical that we would think about primary care and the role of general practitioners because they are the first port of call for anybody with a health concern, and they are the places where commonly new mothers go with children to be reassured and to be supported through the early months of their child's life. So they're ideal as a platform for both education and information, but also for support to understand the importance of self-care where there are people who appear to have difficulty with that or to have lack of access to information and resources in their daily lives. So could we see general practice as needing to be supported, because it can't do it without support, to assess people's understanding of self-care and good health and health care, and then offer some form of supportive package of information, engagement with a practice nurse, something like that. We could see that being perhaps focused on young families in particular, and therefore identifying young families at risk of not having that skill and working with them. We are absolutely saying that that's what's needed around risk factors in adults for preventable chronic disease. So our work for the last several years has been saying very strongly that we need to assess people for risk, and we need to recognise the risk, and we need to provide services designed to reduce that risk where that is possible. That's self-care, because the person has to engage in changing behaviours. If you're if you're overweight, if you're not physically active, if you've got a very poor diet, if you're a smoker, you're at so much more risk of everything with those four that if we see general practice as the place to identify those risks and intervene in those risks at the earliest possible time, then general practice will need to be helping the person to engage in self-care, because it's not health treatment that's going to change those risk factors. It's a whole range of other things, including perhaps having access to a gym. If you can't afford one, how can you go to one? If you live in a suburb that doesn't have walking tracks and it's a highly dense industrial area, how do you go for walks and feel safe? We need to address what helps people to self-care in communities where it's harder than in others. So I think clearly general practice is going to be an important platform for self-care. We also need to have more of the notion of self-management in chronic disease management as part of the system. Policy advice, we have a national strategic framework on chronic conditions that was established in 2017, which provides lots of guidance about how we should be addressing chronic disease and how people should be assisted to self-manage. But there's no way of actually providing additional supports to those for whom that is difficult or a foreign concept, or where language is a barrier to understanding how to engage in self-management well. And it's a hard one, because ministers and treasurers and governments and the population see it as entirely appropriate that health dollars pay for doctors, hospitals, nurses, etc. Because we are only really grasping that wellness matters and is protective against disease in recent weeks. Yeah. We've not really grasped that as a nation at all. And worldwide, it's a growing understanding. Organisations like Parks Victoria that see themselves as providing healthy spaces for good health and well-being. That's 180 degrees from where Parks Victoria might have been 20 years ago. And we now have, in Victoria, there's the municipal health and wellbeing plans that the state government mandates local governments to develop. So they see local government as having a role in health and wellbeing. We've yet to resource that in any systematic way, and it's yet to be a systematic approach across the country. So there are pockets of really good initiatives. There are strong understandings, largely in most health organisations, but they're so totally consumed by their need to provide illness care that being able to engage in wellness strategies is a luxury they often can't get to. Self-care, my own healthcare, self-healthcare is, I'm a very privileged person. I've had all the resources most of my life to maintain my own health. So I know about good diets. I have known since I was a child. I've been physically active. I don't have any of those risk factors that I enumerated a moment ago. So I'm privileged, and I'm very mindful that good health needs good work, not necessarily hard work, but good work. And you need to maintain your health, and I've been able to do that. In terms of my mental health and well-being, my spiritual well-being, I'm very indulgent in what I regard as good music. I like music in my life whenever I can. And I used to walk a lot. I can't at the moment, as I've had hip surgery and have some residual difficulties. And that's a great grief, because walking is so enjoyable. Not only does it get you out looking at things beyond the four walls of your office or your home, it's also a way of connecting both with nature and with other people. And I particularly love walking on beaches, and that's unfortunately somewhat denied to me at the moment. So I'm looking forward to getting back to that as soon as I can.